and for the final tool, you have this AI assist for emergency department X-rays. And again, that's diagnostic assistance. I mean, you have a short example of what that looked like earlier. That includes a workflow as well, and then a couple other set features. But why emergency departments for specifically? And can you talk about some of the important features of this tool as well?
Sure. So radiologists, I would say aren't the user of this tool, and I'll tell you why. Radiologists can look at an X-ray and can do much better than AI at an experienced radiologist at detecting what's happening in this image. And so if you're trying to augment with AI something that radiologists do really, really well today and very fast, it's a much higher barrier to entry. So places where you're seeing more adoption of AI is in areas where potentially radiologists aren't involved, or it's not about making them 2 seconds faster on an exam. It's more about if you can really provide something new that hasn't been done before. In the case of the cardiac MR, they weren't able to do 40 flow before, so we offer them a whole new tool to be able to measure blood flow. So with X-ray, there's a specific problem happening in Europe where X-rays aren't read, especially in the ED departments. They're not read because the volumes are too high, and there's just not enough radiologists to read them. Not only at night, so of course the issue is exacerbated, off hours, but even during the day, these exams aren't being read. So you have patients in the ED that could have been discharged hours earlier, or essentially could have been prescribed treatment much faster than that ED physician looking at that X-ray and being a little bit uncertain, and then having to call the radiologist, say, hey, like, I don't know how to read this, like, what do you think? It's just not efficient. So what our chest X-ray product does, and MSK X-ray product, is that it allows that ED physician to be empowered to give them the same level of knowledge as a kind of a mid-junior level radiologist. And the reason I say mid-junior level is because AI will never be as good as a experienced radiologist. But if we can at least bring the level of knowledge up for non-radiologists up to that kind of mid-level, then that will be sufficient for them to say, I'm going to let this patient go, or if this patient has a pleural effusion or has a dislocation or has some fracture, whatever is in the X-ray exam, it can be speed up the whole process of treatment. So there's a specific need for that in Europe for frontline physicians, and I would say that need is different than in the U.S. And in the U.S., it's almost all X-rays get read. Maybe not maybe the turnaround times are long, but and eventually that product could be brought into the U.S. market, but the value prop isn't as high as it is in Europe.